Welcome to The Rubber Meets the Road Economics, the podcast where we explore the driving forces behind today's economy and their real-world implications. Join investor Hunter Craig as he interviews Professor Edwin Burton from the University of Virginia, delving into the complexities of economics with clarity and insight. Whether you're an economics enthusiast or just curious about how economic policies affect your daily life, you're in the right place. Let's get started.
Today is November 13th, 2024. We're here today with world-famous Professor Edwin Burton. Thank you for being here.
Thank you, Hunter.
Medicaid, Medicare, Social Security. All this stuff funnels into the U.S. debt problem. Can you speak to the serious debt problem in the United States? What happens?
You talk to people and they say, well, why don't we cut spending? Well, how do you do that? Eliminate Social Security, get rid of Medicare. You got to pay interest on the debt. There's no easy spending place to cut. And they say, well, let's raise taxes. Really? Taxes are already at record levels. The total tax intake is not $5 trillion, it's $6 trillion in this country if you put corporate income tax and personal income tax. And people are kind of at the breaking point. If you live in New York City, your marginal tax rate is 60%. Where are we going to take it? 80? And even if you don't live in New York, here in the state of Virginia, it's in the high 40s, almost close to 50% at the margin. These are very high tax rates. Some countries in Europe actually have lower tax rates than we have. That's probably not something people would expect. But I think there's not much mileage to reducing the deficit by either way, by spending reductions or tax increases. It's not going to get done. You need to reform healthcare. So much of the spending is driven by healthcare. If you look at Obamacare, if you look at Medicare, and you look at Medicaid, that's really driving the entitlement buggy. And if you don't reform it, the problem in healthcare is anybody that uses the healthcare system in America assumes someone else is paying for it. They don't assume they pay for it. No. Somebody else is paying for it, either your insurance bill or Medicare or somebody else. Well, if you walked into the grocery store and assumed somebody else is paying for it, what you'd pick up in the grocery store would be a lot different than what you'd pick up if you had to pay for it yourself. And that's what's wrong with our healthcare system in this country. People do not feel like they pay for their health care, and they're not good shoppers, and they don't take care of themselves. If you tell a person, we don't care what you eat, what you drink, whether you get exercise or not, just live any way you want, and if you really get badly ill, we'll take care of you. It doesn't matter why you're having these problems. Well, if people know that, and they know that somebody else is going to pay for their health care if they end up getting obese or end up using drugs or become alcoholics or smoke too many cigarettes, if there's no penalty for that in terms of the healthcare system, well, what the heck? Let's go for it. But if people feel like, well, maybe if they get one of these diseases that come from smoking, for example, lung cancer, you can get lung cancer for a lot of reasons, but smoking is the best way to get it if you really want it. And so if you smoke like crazy and you get lung cancer and you assume the guy next door is going to pay for your surgery, why stop smoking? So you get behavioral consequences for the fact that you don't feel like you pay for your own health care. And if you look at healthcare expenditures, we're spending a ridiculous amount of healthcare expenditure in the last 2 years of everybody's life. Hunter, the amount you spend in your whole life on healthcare, the vast bulk of it will happen in the last 24 months of your life. And that's true of everybody. Well, that's kind of silly. Would I spend millions and millions to take care of myself in the last 2 years of my life? No. I'd rather save those millions and millions for my children and grandchildren. But that's not the choice you have. The choice you have is you've got Medicare sitting right there or Medicaid, and okay, somebody else is paying for it, and boom. So we end up spending more per capita than any country in the developed world, and we get worse healthcare outcomes. Our healthcare system's an embarrassment. So you need to reform that. The best way to provide good service at a good price is to get more competition into it. So you need to reform healthcare. You need to bring market forces to bear on healthcare. Not for everything. You need insurance to take care of catastrophic situations. You need to protect people who have pre-existing conditions. You need to protect people who genetically or through no fault of their own end up in precarious situations. That can be done, and that's not that expensive. But if you just insure every item somebody does, which we do, And we insure the wrong things. We're busy insuring predictable things, doctor visits. Anything that's predictable doesn't need insurance. You want to insure things that would bankrupt you. Big expenses. Uh-oh, I've got cancer, so I need help. And you should pay your own insurance for that. Just like if you wreck your car, why should the guy next door pay to have your car fixed? You should carry insurance and have it fixed yourself. And that's what we need to think about in healthcare. But I could say the same for Social Security. Social Security is a terrible system, creates no wealth. When you die, that's the end of it, unless you have a spouse, and then she gets some kind of remainder. But if you're single, let's say black male, and that demographic dies much faster than single black females, or any white folks, at least in the demographic data. So if you're 63 years old and you're, say, a black male single and you've been paying into Social Security all your life and you die at 63, well, you should have triggered Social Security at 62 then, so you get at least 1 year before you died. You paid in literally millions of dollars and you get nothing, and your heirs get nothing. It's a terrible system. Terrible. It's much better to just mandate IRAs. Just say, hey, every year set aside $1,500 and just mandate it. Just take it right out of people's check. And don't let them withdraw for emergencies or withdraw to build a house or first home. Make them leave it there until they're 65 and make them put at least 60% of it in the stock market or something like that. And people say, oh, you can't mandate it. Well, look what you're doing with Social Security. You're taking 13% of everybody's pay. It's 6.5% for the employer, 6.5% for the employee. 13%. So in Virginia, if you make $70,000 a year, 10,000 plus goes into this system. You'd have a better retirement if you just put $1,500 away and just put it in the stock market. And you need that kind of reform because the demographics are suggesting we're going to be like Japan at some point. We're going to be a nation of old folks. And the working population is going to be smaller. And you're not going to be able to keep playing this Ponzi scheme where you collect tax revenue from people who are working and pay it out to old folks. It's not going to work. Social Security is estimated to be gone within the next 10 years. We'll run out of money in Social Security. And then they have an automatic cut of 20% in the law. The minute it runs out of money, if no congressional action is taken, everybody's benefit drops 20%. So some guy who's 80 years old has been collecting benefits, $2,000, say, a month, all of a sudden, boom, $400 disappears from now on, you get $1,600 a month instead of $2,000. Now, maybe Congress then says, oh, we're not going to do that. We're going to fix Social Security by taxing. So, okay, we'll tax you another 5% on your income. How many people would like to do that? Nobody. And the answer is to let people save for their own retirement. Just mandate that they have to, that you have to put aside $1,500 a year. If you put aside $1,500 a year by your own calculation here on an earlier pod, you'd end up with $2 million when you're, and that's your money. Social Security is not your money. When you die, that's it, unless you've got a spouse. We should think much more clearly about creating wealth for people and then let people decide if they want to retire or not retire.
CEO of BlackRock this week wrote an article in the Wall Street Journal stating that the solution is infrastructure spending and growth. Professor, how do we grow out of this problem?
Infrastructure spending in the abstract sounds great, doesn't it? We're going to build some new roads, new highways. That's not what ends up happening. Infrastructure spending is very subject to the political world. If you drive around in Charlottesville, you run into potholes everywhere. But I have a home up in Weems, and we've had roads up there repaired about every 4 years. Our roads are unbelievable. Now, that's great for a county with 10,000 people living on it, and so maybe you have a few cars driving here and there. So who decides that our roads are fixed every 4 years? That's the infrastructure spending. It's ridiculous. It's different if you target specific things. Here's our plan. We're going to fix the roads. But if you just pass a bill like we did, the infrastructure bill, $1.3 trillion or whatever it was, or the CHIPS Act, I bet you if you took a poll of people out walking up and down the street and asked them, can you name one thing in the CHIPS Act? Well, I can tell you right off the bat, it wouldn't be chips. Very little of the CHIPS Act had anything to do with chips. And the same thing with the Infrastructure Act. There's so much pork in the Infrastructure Act that was passed by Congress. And so who gets the money? Well, let's see. We got a race going on in Arkansas. I think we need a bridge over here because we got a congressman that is in trouble. So let's go build a bridge. And then you have a big ceremony and the congressman comes out and somebody comes out and says, look, we're going to spend this money building the bridge. It ends up mostly being a pork barrel operation.
Well, how about growth?
Well, economic growth's not going to help you very much because, so you increase tax revenues, whatever, 3, 4% a year. That's not enough. It's not going to help. You just can't drive the bus with growth. You need to think seriously about what percentage of your total economy can be government driven. And it can't just be any number and growth will catch up with it. We know that. Why? The interesting question I would ask is why, if this makes sense, we've been growing pretty fast. We've been growing at a rate of 3% the last 4 or 5 years, and the debt has doubled. All that growth, what happened? Why didn't it work? Growth does not solve the problem if you're constantly stroking the flames and spending more money. We spent nearly $11 trillion, an economy that only produces $28 trillion a year at that time, $28 trillion a year. It's $11 trillion additional dollars beyond everything else we spend. And that all went right into the debt. And they got help from the central bank. They bought a bunch of it, which is why you ended up with inflation. You have to reform the way you do things. Government is not very good at providing health care. And those of you who think it is, good luck.
We need to talk about this every week. Thank you, Professor. Thank you.
Thank you, Hunter.
Thank you for joining us for the Rubber Meets the Road Economics podcast. If you enjoyed the discussion, remember to subscribe and stay updated with future episodes. Join us soon for more conversations about modern economics on the Rubber Meets the Road Economics podcast.